Welcome to Break the Rules with Dr. Lauren Lax, a podcast dedicated to quieting the noise in the health, food, and fitness world. Dr. Lauren is a leading nutritionist, therapist, and functional medicine practitioner on a mission to help others thrive in their own lives, mind, body, and soul. And now, your host, Dr. Lauren Lax.
Well, hello. Welcome to another edition of the Break the Rules podcast, where we talk about quieting the noise in the health, food, and fitness world. And today, I'm super stoked to have Dr. Christina Bjorndal in the house. And she is a naturopathic doctor who is an authority in the treatment of mental illness, such as depression, anxiety, bipolar disorders, and eating disorders. Basically, from having overcome many of her own mental health challenges herself. She is a gifted speaker and writer who loves to share her philosophy of wellness in interviews with icons like Jenny McCarthy and many more. She is recognized as one of the top NDs to follow by 2 independent organizations. And she's also just helped many patients achieve physical, mental, emotional, and spiritual well-being through her she's got 3 books out there, a 10-week course, and really just an amazing one-on-one practice. And I love the bridge that she is taking for merging a more holistic approach to overcoming a lot of the anxiety, the depression, and mental health struggles, eating disorders that can feel like they stick with individuals for quite some time, and really giving you power-packed ways to transform how you're thinking and how you're feeling versus just managing symptoms. And so, Dr. Chris, thanks so much for coming on the show, and really excited to have a really good conversation about ways that we can improve our mental health well-being without, again, just managing it. And would love to know some of your background and what got you doing the work you're doing in the world today.
Yeah, thanks for having me, Lauren. It's great to be here. So my background really, the reason I became a naturopathic doctor was through my own journey and struggles with my mental health. And that started in high school when I developed an eating disorder. And I really struggled with perfectionism and being an overachiever, and that eating disorder sort of fit into that realm as well. And so I found myself really managing my stress with food, and it became a coping mechanism for me. Eventually, I ended up, this is actually, I talk about it in my book, Beyond the Label, and I don't usually mention this when I do interviews, but it is the truth, and it's a little bit of a shame thing for me, but I'll just mention what happened was I got caught shoplifting the food, and that was the turning point for me. The manager of the store said that he was going to give me a criminal record if I didn't have a parent come and speak with him. So I had to fess up to what was going on. And at that point, I was terrified to let my mom know what I was doing. And anyway, she was very supportive, and everything worked out fine, but she asked me, did I want to get help? Like, was I ready to admit that I had a problem and I wanted to get help? And I just said, no, I don't need any help. And then the following winter, because I no longer was engaging in bulimic activities, I was still binging, but what I did was I became an over exerciser. And so that's sort of how I managed things. I stopped purging, but I continued on with that stress behavior. And I found myself actually in a place I'd never been before that following winter, which was depressed and quite suicidal, super anxious. And I ended up getting prescribed medication for that. And then after a few months, I spun out of control into a place I'd never been before as well, which was basically not sleeping. I was really had a lot of energy, was euphoric, ended up spinning out of control into a delusional, psychotic, manic episode. And it took 6 people to wrestle me into a straitjacket, and off I went to the hospital, where I was injected with a powerful antipsychotic and left in a rubber room. And when I came back to reality, I was diagnosed with bipolar disorder type 1. Yeah. And so what I did with that is I pretty much shoved it it as far away from me as possible. I didn't want to have anything to do with it. I didn't, that was not happening to me. And I continued wearing this mask of perfection in the world and putting myself out there like I had it all together, but really I was struggling on the inside. And basically the next sort of major turning point from a mental health perspective for me was a few years after that. I had a suicide attempt that left me in a coma with kidney failure, and I was on dialysis. And when I came out of that coma, I certainly wasn't happy that I was still here, but I realized that I needed to figure out another way to navigate this journey and and this diagnosis that I was so ashamed of. And I was given a book to read by Marianne Williamson, and there was a quote in this book about surrender, which goes along these lines, that surrender is not about breaking out of anything. It's a gentle melting into who we really are. So we let down the armor, we take off the mask, and we discover that all God needs is one sincere, surrendered moment where love matters more than anything and nothing else matters at all. And so the two key words in that phrase for me, in that quote or in that passage, is love and surrender. So I realized that, I didn't love myself. I didn't accept who I was. I really had been at war with myself for many, many years. And so that really was the journey I started and have been on for the last, since 1994. So for several years now, 36 years. And it's really brought me to this place now. So I ended up making a career change after getting some help myself from a naturopathic doctor and, realizing that there are lots of people who struggle, but I had a hard time finding somebody who could help me when I was struggling. And so, so that's basically the journey in a nutshell.
Mm-hmm. Wow. A very power-packed journey in a nutshell. A little bit about, so naturopathic doctor for helping someone with mental health challenges. That's not usually the first line that someone's Googling when they're struggling and seeking help. Talk a little bit about how you stumbled into finding naturopathic.
Yeah.
Yeah.
Yeah. You know what? It really was through my friend. Like I had a really close friend and she was very naturopathically inclined and she was a nutritionist, and the same friend that gave me that book to read that book was Marianne Williamson's book, A Return to Love. So she really was always encouraging me to look into alternatives. And I was with her at Canadian Health Food Show. There's a conference that happens. It's called the CHFA, Canadian Health Food Association trade show. And I picked up a flyer for a mental health regained public forum. And there was a doctor that was speaking at that event. And so I went and I learned about nutrition and supplementation. And so I ended up going to see that person. His name was Dr. Abraham Hoffer. So he actually wasn't a naturopathic doctor. He was a nutritionally oriented psychiatrist, if you can believe that. Back in the 90s. Yeah, there weren't that many nutritionally oriented psychiatrists around. Now there's more, but at that time, I think he was probably one of the only ones in the country. And I had been to see a naturopathic doctor as well. So with the two, the approach from both of the doctors that I saw, I implemented their suggestions, and I had my first year where I felt free of depression and anxiety, which I hadn't had in the 15 years prior. From like age 18 to 33, that's when I really struggled for 70% of that time. From that 15-year period, I was either depressed or anxious or dealing with disordered eating or body image issues. And after I started the nutritional protocol and changing my diet, I couldn't believe it. It's like the veil was, the cloud was lifted from from in front of my eyes, and I saw the sun again. And that's when I realized, that there's other people that need help, and this can't be the only guy in the country, you know. So
Mhm.
that's what prompted me to make the career change. But I was going to mention too, just as an aside, an interesting side note. In the year prior to developing the eating disorder, I did antibiotics to treat acne for several months. And we didn't know this then, but we know now that there's a relationship between the gut and the brain, and especially with eating disorders. So I just mention it because I want people to really understand that your whole history is important. And I'm not saying, never to take an antibiotic, but I am saying if you have, and then you subsequently went on to develop mental health issues, you do need to take a look at the disruption that may have occurred from that gut microbiome perspective.
Yeah. So let's kind of dive into that a little bit as far as like as practitioners, we talk about looking into the root causes a lot of
Yes.
things. Explain that to the listeners though, like what that really means to like look into, okay, I took an antibiotic, I know as a kid, and now I have anxiety. Like what's the link there? And what is it as practitioners that we're helping them look into?
Well, I think we want to understand too that there can be a few roots as well. But if, for example, you have taken antibiotics, and it may have to be more than one, it really just depends. But there's testing that you can do to discover whether or not there's been a disruption to your gut flora. And also it's a matter of understanding your digestive health and having a line of inquiry around that, in terms of how frequently do you have a bowel movement? Do you have gas or bloating? Does your stool sink or float? Do you have heartburn? All of the answers to these questions help us as the investigators determine what level of disruption there might be on a gut level. But from a root cause, we want to understand that there are three macro systems within you, and these three macro systems, imbalances in any one of those can result in symptoms of mental health. So the macro systems are your neurotransmitters, your hormonal or your neuroendocrine system, your hormonal system, and then your organs of detoxification, which includes the digestive tract as part of that. And so I know for myself, I had imbalances in all three of those areas. And it's really a matter of taking a proper case, like a thorough history, and an investigative inquiry into what could be the root or roots for each individual.
It's so interesting that we're talking about this now. Right before recording this podcast, I got a call from Yelp, which they typically call a lot of business practitioners, but we're just inquiring me about the services that I offer. And like basically this more holistic approach that I similarly take as you is just not really mainstream. It's just like, oh, I've never heard of a therapist that's looking into also like the brain gut connection, which is so huge. Talk a little bit about for you why and how that began to turn on. I know you mentioned a nutrition program, but really like what was your life before on the health front, like what you were doing on a daily basis, feeding your body, and how did that change as you began to heal?
So, like, how was my life before I saw Dr. Hoffer or Dr.
Yeah,
Chan?
exactly. You said that
Yeah.
you started to follow their protocol.
Yes.
But I assume, and as a lot of the listeners with an eating disorder background, you were already health conscious or aware, perhaps, kind of aware of
No,
health.
well, that's the thing, right? It's such a relative concept. So
I know.
this is the thing. I thought I was healthy, but I so was not healthy.
Exactly.
So
Talk a little bit about that. Some of
yeah,
those light bulbs that you discovered.
so for example, I lived in my apartment for 7 years and never. So let's give you an example, or that gives you a little bit of insight into my lack of caring for myself from a cooking and nurturing perspective. So yeah, so really I had a high stress job, and I would come home from work and I would have a baked potato in the microwave, and I would pour salsa on top of it and maybe some cheddar cheese. Like that's what I would have for dinner.
Mhm.
So I would actually, so I was a vegetarian for a few years, and there was very few vegetables in my vegetarian diet. So I
Right.
was
Mhm.
more of a carbitarian.
Mhm.
And so I would have like canned soup, and my diet was terrible. But I thought it was healthy, which is the irony of it all. So when I went to see Dr. Larry Chan, he was a naturopathic doctor, there was some food intolerance testing done. And in naturopathic medicine, we talk a lot about leaky gut syndrome. And so for people who don't know what that is, basically you want to understand that you're one tube from your mouth to your anus, and that tube needs to be solid like a pipe. But what can happen through poor diet, medication use, stress, instead of the cells in the small intestine being tight, like the junctions being close together, the cells get gaps between them in a sense, or they get leaky. And so what happens is the food particles go through into the bloodstream, and then your immune system mounts a response to that, thinking that it's something that is foreign and needs to be attacked. And this can contribute to a whole constellation of symptoms in people, from migraines to acne to eczema to depression, anxiety. So so for myself, the foods that my immune system was responding to were wheat, dairy, sugar, eggs, and chocolate. So, and I also had a level of overgrowth of a yeast in the body, which is called Candida, who loves to survive on sugar. So sometimes when you crave sugar, it's not actually you that's craving the sugar, it's the organisms within you that are sending signals to your brain so that they can survive, because that's their food source. So for me, it was very daunting to cut out wheat and dairy out of my diet. I didn't know at that time that there was other grains other than wheat. I mean, I really had very little knowledge about nutrition or health for that matter. So when I removed these foods, my skin cleared up. I had more energy. I slept better. Like I said, it was like that cloud was lifted. And at that time, I was still taking 5 psychotropic medications. So I eventually weaned off most of those and just maintained the nutritional piece. But I think I do want to highlight here is when I went to naturopathic school, we had to analyze our diets as an assignment in second year nutrition. And the only essential amino acid that I was deficient in with my diet, based on the analysis of my diet, was tryptophan. And tryptophan is the essential amino acid. So that means that you can't make tryptophan yourself. You have to get it from your diet. And if you don't, then what tryptophan does is tryptophan gets converted in the body to serotonin. And serotonin is that main neurotransmitter that is often implicated in depression and anxiety. So when we talk about the root cause, I just want to really highlight here the reason I got better is because the doctors I was seeing were supplementing me to fill that pathway, to support that pathway, that tryptophan pathway in my body. But nutritionally, I was not able to get there on my own because my diet was so horrible. So once I learned that, I changed my diet even more to ensure that I was eating tryptophan forming foods and was able to then not need to take as many supplements as well.
Yeah, really fine tuning what you were missing.
Yeah.
I would love to know now, as a practitioner, what are some common themes you see in the dietary choices and lifestyles, not just nutrition only, but of the clients that you work with that are perhaps like big ahas or missing links, that you're like, man, this can make such a difference for how this client feels.
Yeah, I think one of the biggest things, so the diet piece is so many people, I mean, just some of the basics, right? So many people are drinking far too much coffee, far too much pop, far too much sort of stimulating drinks because they're not getting enough sleep and they don't feel like they have enough energy. But as a result of that, they're depriving themselves or not drinking enough of water, which is one of the basics that we need. I mean, our bodies are 70% water, right? We're not 70% coffee. So some of the really simple things that we sometimes think, really, like that, that's going to help, makes such a big difference. So, and I think for me, the biggest area as well is I don't really want to overwhelm people. So I do try to keep the changes simple. And I'm always about what can you increase in your diet? So bringing in the good, not so much about excluding the quote unquote bad, but I find that if you focus on what they can add to their diet versus subtracting, that it tends to outcompete the bad anyway. So I know that for myself, like I said, when I had to cut out wheat and dairy and sugar, that was very daunting. And for most people, it is extremely daunting. So I find that I start with increasing the good foods, i.e., increasing vegetables primarily into the diet, and then cutting out the refined products is what helps people in the long run. And then for me, what I think makes a world of difference is, especially with mental health, is working on that individual's self love, essentially. So a key question that I ask is, on a scale of 1 to 10, how much do you love yourself? And most people, and if for people who are listening, just answer that question for yourself. Most people give a very low number to that. Very rarely do I get an answer over 5. And so for me, I think that's really where we need to start with people, is increasing this sense of their relationship with themselves. I know for myself, I was at war with myself for many, many years. And so I really understand this piece of the puzzle. And most people who are struggling are, to some degree, at war with themselves.
Why do you think that is?
Yeah, I think partly, I don't know if it's so much a gender issue. I see way more women than I do men, but I just think in a way we're just not reared that way, right? We're not encouraged often as women to be. It's almost like if you're proud of yourself, that it's not good to be proud of yourself. It's looking at, it's like, oh, you're conceited versus confident, right? If a man is proud of himself, it's like, oh, he's got confidence. Whereas with a woman, it's often, oh, well, that's being conceited. And I think we just need to shift that dialogue. So I think it starts sort of with the way the messaging that we get, and it's a cultural thing, I think.
I know a big part of my struggles with the eating disorders and anxiety that kept driving me was just that not good enough, not feeling enough. Mm-hmm. And I think I find in practice, helping an individual find where were the tipping points or some of those messages that were downloaded really early where that began to shift. And so I distinctly could remember back to 9 or 10 years old, wanting to fit in with the popular girls. And then from there, just making that I'm not enough story louder and louder and louder. Do you find that tends to be the case, or do you find it's just it's really hard to pinpoint? It just is what it is. And it's just.
No, I agree with you 100% that for most of us, for all of us, we've received some sort of messaging at some point, and usually it happens in childhood, not always, but usually. And then what happens is we make core beliefs, or we form beliefs about these and these experiences, and then we have a story in our head. It may or may not be true. That's the thing. But we end up what drives our behavior is this belief. And so until we can bring that belief into the forefront and learn to change it and change the story that we're telling ourselves, then that's when the healing can happen.
Yeah, writing a new story. When your clients come to you, are they typically you're the 7th doctor they see, or how do you I guess you bridge the gap between traditional to a more holistic approach?
Yeah. Yeah. So often, oftentimes people have been to see several other practitioners before they come to me. Other times not. They're referred from, from another patient, or even I've developed a network of people, other practitioners, within the city that refer to me. So it really just depends. I sort of see the whole 9 yards in that regard.
Where do you start then walking someone to freedom?
Hmm. Yeah, so basically I talk about there's 4 aspects to you: the physical, mental, emotional, and spiritual. And that I explain that in the Western system, most people are focused on that physical level, but I really like to look at the mental, emotional, and spiritual aspects. And so in my book, Beyond the Label, I talk about the 10 steps to achieve mental wellness with naturopathic medicine. And so the foundation, and then as I mentioned earlier about on that physical level, we have the 3 macro systems. So we're wanting to determine which of those 3 or all 3 of those systems are we going to be supporting on that physical level. But then, and so we're doing that by looking at, doing functional testing, blood work. We might do organic acid testing, food intolerance testing. There's different tests that may be required. I find that the more thorough of a case you take, the less testing you need to do, but definitely I think we need to get some current baseline blood work. And then we want to look at the nutrition, diet being one of the, diet, sleep, exercise, and managing stress. Those are the foundational sort of 4 pillars of your health house, so to speak, and giving suggestions in those areas. And then the next area, usually this is more so in the second visit, sometimes in the first visit, depending on what I've picked up on from the patient. I'll start making suggestions around it from a counseling perspective. So I have additional training in 5 types of counseling that I incorporate. And so my next areas that I think is really the most important to work on. I mean, they're all important, but it's hard to say which one's the most important. But we're then looking at your thoughts and your emotions and how you behave and react in the world, and understanding the role the environment can play in your health, and then the role of love and compassion and spirituality. So ultimately wrapping everything up in that love piece, because at the end of the day, if if the patient is not, if they're at war with themselves, then it's going to be hard for them to implement the changes. So we really want to work on that love piece, understanding that they have a purpose, that they're meant to be here, and they are of value, and to work on changing that narrative, as we talked about. What are the core beliefs that are driving you, and how can we shift that conversation and do some compassionate inquiry to get you to be gentler with yourself. So that's basically the approach that I take, but with a big emphasis on this thought, emotion, love piece, because I think that until you learn to manage your mind, you're going to be at the mercy of it. Yeah.
Yeah. And I think that can definitely segue into how we feel physically too, like the mind, the stress, driving gut inflammation. It's bidirectional.
That's right.
So not just focusing on physiological or mental. I know before we got on the call, we were talking some themes that you've been seeing with your patients in conversation is the ability of presence, or talk a little bit about kind of what you've been seeing in the midst of a epidemic, pandemic, and working with clients around anxiety and mental health struggles already that may even be flared during a quarantine, or just like not normal life.
That's right. Yeah, exactly. So that one of the key things to remember is, so I always ask people, there's 3 places that you can live in your mind. So you can be living in the past, you can be in the present, or you can be in the future. And of those 3, which one exists? The only one that exists is the present moment, right? So what with this current environment that we're in, many people have a lot of fear and anxiety and worry and angst about the future, or financially they're concerned about that, their job or their home, they're to be able to meet the payments that they have, but also they're fearful about, are they going to get sick? I mean, are they going to get this virus. And so we have to constantly remind ourselves that worrying and living in the future is actually not going to help you in the present moment. And the reason physiologically that it doesn't help you is because there's something called psychoneuroimmunology, which is just a fancy word that means your thoughts affect your physiology. And so basically, the thoughts that you think create neuropeptides. And then the neuropeptides affect the hormones that get produced. And those hormones that get produced in turn affect how you feel. So it's a bit of a chicken and an egg problem that we have here. So, and if we're always thinking stressful thoughts, then we're in a sympathetic state. And when we're in a sympathetic state, we're producing more cortisol, which over time, if we continue to do that, we end up in a more depleted state because it's like you run out of gas. And then that sets you up to be immunocompromised. So we always want to be coming back to the present moment as soon as you recognize, oh my gosh, right, I've been thinking for the last 10 minutes about worrying and being quite anxious about X, Y, or Z. Then just do your best to come back to right here, right now, connect with something, preferably in nature. There's just a breathing exercise that I have people do to sort of engage them, like a grounding exercise to engage them in the present moment. And then think about, well, what is it that you want to have happen for yourself? So again, the future hasn't happened yet. So instead of freaking out about the future, why don't you think, well, what is it that I would like to have happen? And then sit back and see what unfolds for you. How does the future show up in your life? This gets into the work of Joe Dispenza and the reticular, it's called the reticular activating system of the brain. And people have probably heard, intention setting, this idea of basically affirming the outcome until you know what the outcome actually is. Why not rest in something that is serving you? Because then this is going to serve your physiology, coming back to the psychoneuroimmunology piece. This is going to shift your physiology over to a parasympathetic state versus that sympathetic state. And remember, there's certain functions in the body that can only happen when you are in a parasympathetic state. One of those is digestion. And as naturopathic doctors, we're all about digestion and food, but the state in which you're in when you're eating the food is just as important as the food that you're eating. Because if you're in a sympathetic state, the chances are you're not going to absorb as much of the nutrients as you could be if you're in a calm, relaxed state. So that's kind of a long explanation to basically say that you are always wanting to check in with yourself. Okay, where am I living right now in my head? What's the conversation that's going on? Is it serving me or sabotaging me? Is it helpful or hurtful? If it's not helpful, how can I move into the present moment, do the breathing exercise by looking out at something in nature, taking a couple of deep diaphragmatic breaths, and then switch the conversation to what is it that I want to have happen. So if you do those 3 steps, I think that will really serve you. And just understand that, one of the things I think that this pandemic has taught us is that, there really isn't a lot that we can control. But what we can control is our thoughts. And that is that's within your realm of possibility. So do your best with that.
Is there a way to make that, like, I feel like when I was struggling with my eating disorder, I wanted to control my thoughts, but my thoughts were so controlling me and I just could not really do it on my own. And I think a big aha was turning on like the gut brain axis again, like that physiologically did help. When I think back to that time, like I think that there was also a big piece of like surrender for myself, like something greater than myself had to help me. Is that something that you find is thematic as well? Or like, is it a will it done? Like it can be overcome just by continuing to practice, try this. Like what have you found thematically with the majority of clients you work with and helping them really master their mind? Because it's really hard to do when you're feeling so weighed down.
Well, I think as we were mentioning earlier, if you have that level of dysbiosis, or if you have candida, then it is going to be challenging, right? Because it's almost like you're possessed, right, by another organism, right? So working on that and creating the shift physiologically is going to help create the shift from a mental perspective. But it also, I think it's multifactorial, and I think we have to work on all these levels. And I think it's about looking at why it is that we're reaching for what it is that we're reaching for. And so if you can create a little bit of space around that to be able then to uncover, well, there's usually a belief behind it, as we were talking about. And so if we can get to that belief and then reframe that, that does help to then shift the behavior around the eating piece. So a tool or a tip that I can suggest to people is from cognitive behavioral therapy. It's called the 5-minute rule. And what you do is, when you recognize that you say you want to have a piece of cake or a bag of chips or whatever it might be, something that isn't healthful for you. So just instead of saying, well, no, you can't have that, then you just say, okay, I'm going to set the timer for 5 minutes. And in that time frame, when the buzzer goes, you can have that if you still, so desire. But in that time frame, check in with yourself as to what are the whys driving that? What is it that you really need in that moment? Maybe you need a hug. Maybe you need to punch the pillow. Maybe you need to journal. Maybe there's some other sort of emotional need that needs to be met in a different way. Because you have to understand, in your prefrontal cortex, there's this triangle set up between the I will power, the I won't power, and the I want power. And as soon as you say no, it's often like that side of you that like a spoiled child sort of starts having a temper tantrum inside your head that says, like, no, I want it. I'm going to have it. You can't tell me that I can't have it. Right. So it's that, again, that's, when you resist, it persists. So instead of that, you're just saying, hey, can you just take a little bit of a timeout, and I'll acknowledge you in a minute, and then really check in with yourself about, again, what is it that you might really need? Then when the timer goes, if you want it and have whatever it was you wanted to have, then have it, but have it consciously, with each bite asking yourself, do you want to continue? And also in that 5 minutes as well, what I often do is I have something healthful. So I'll have some organic blueberries, or I'll have an apple or an orange, usually a piece of fruit that's sweet. And oftentimes that satisfies that desire in me. And then I move on when the buzzer goes, because we also want to recognize, as we were just talking about earlier, being in the present moment. And so sometimes you have that desire or craving or urge or drive in that one moment. But if you just paused, took a deep breath, it may pass in the next moment. So always giving yourself permission to rest, always giving yourself permission to stop. If you start, give yourself permission to stop as well.
Yeah, giving yourself permission. I think that's a huge thing in general.
Yeah, because you know what? I think if we deprive ourselves, like if we say, no, you can never have something, then that's what sets you up, I think, for just to stumble. And I think for me, it's not about, never not having anything. It's about how I'm feeling when I'm having it, and why am I having it, and how does it serve me, and what is it doing for me? And so looking and asking those questions of yourself, it takes time, and you have to be patient with yourself.
Well, Dr. Chris, thank you so much for just enlightening us to another side of mental health recovery, and just that, like, really healing versus managing hope that you have from your own life even. And where can people find out more about you and your work? And
yeah, so I think just my website, which is drchristina and then bjorndal.com, but hopefully you'll put the spelling out there, because it's a hard one to.
I definitely will. It'll be in
Yeah.
the show notes. Mm-hmm.
Yeah. Yeah. And then just, Dr. Chris Bjorndal on Instagram, and then I'm on Facebook. And the books are available on Barnes and Noble and Amazon in Canada on Chapters. And I just, hope that people just know that if you're struggling in any way, there's doctors like Lauren and myself, that there is another path that can support you in your journey to wellness.